Hi, my name is Guillermo Douglass-Jaimes. I'm an assistant professor of environmental analysis at Pomona College, and I'll be presenting my work, Blurring Boundaries of the Slum Divide Through Precision Mapping in Rio de Janeiro. Community mapping with low-cost handheld GPS devices, digital cameras, and smartphones has increasingly been deployed by community-based organizations to identify environmental and health threats as well as available resources to address those concerns. Though not new, the availability of low-cost, precise mapping tools has allowed for greater sophistication and proliferation of mapping projects. This paper uses a mixed methods approach to analyze spatial data from the youth-led digital mapping project, called YLDM, along with interviews with key participants in the mapping project in order to understand how community members' conceptualizations of environment, place, and health influence their perceptions of and articulation of environmental and health hazards and community resources. I will talk about the discrepancies revealed by my analyses and the challenges faced by low-income communities, and in particular those in low and middle-income countries that continue to lack access to sophisticated mapping tools. Connections between place and health have increasingly been made, yet defining place has been the source of much debate that I don't have time to go into. However, community mapping projects aimed at highlighting the connections between place and health have also wrestled with how to properly represent socially relevant spatial units. Neighborhoods have often been conceptualized through collective identity making, as well as assertions of identity through imposed boundaries. While relying on the theory that collective knowledge results in a more accurate depiction of community, the methods of mapping vary from simultaneously coordinating group mapping activities to aggregating personal representations of the boundaries of one's community. These approaches rely on the assumption that collective map making will ultimately aggregate each community member's depictions of their lives at their center of their neighborhood. Whether the aggregation of individual conceptions of place are negotiated by the participants in the collective mapmaking process or by the mapping software in post-aggregation, the results are assumed to reveal the general boundaries of a community. Community mapping processes have revealed the neighborhoods are not static, and residents' conceptions of boundaries in neighborhoods rarely match the formal administrative boundaries. Few urban spaces exemplify the negative linkages between place and health as informal settlements, or more commonly known terms slums and shantytowns. These areas, characterized by their lack of municipal infrastructure, such as safe drinking water, sewerage, garbage collection, and electricity, as well as low-quality dwellings and irregular building patterns that can inhibit mobility and exacerbate the deprivation of critical infrastructure. Informal settlement dwellers are often described as living in poverty with low levels of formal education and frequently subjected to social marginalization, conditions linked with poor health, whether directly as a result of increased presence of disease vectors or indirectly as a result of limitations residents face in addressing their health needs. In our increasingly urbanized global population, nearly 1 billion of the world's city dwellers live in informal settlements. However, these numbers have been viewed skeptically as an underestimate. In 2010, the Brazilian census, for the first time, actually counted folks who lived in informal settlements nationally. Now, I put here a slide that since 1953, this was done in Rio de Janeiro, which at the time was the capital, but it was not done nationally. So the 2010 census was the most comprehensive, and they included a classification for census. They marked census tracts as being informal, or this term that they use, aglomerados subnormais, or AGSN for short, which were areas that had over 50 households, where the property rights were considered tenuous, and they had an inadequacy of provision of water, electricity, sanitation, and trash collection. So a recent body of literature has emerged examining the slum divide in Rio de Janeiro through the comparisons of the AGSN and non-AGSN census tracts. An analysis of the 2010 census found that residents of the informal city are poor, less educated, and have access to lower quality municipal infrastructure than their formal city counterparts. However, their analysis also revealed a high degree of variability within the non-AGSN or formal city. Similar mixed results emerged in comparisons of tuberculosis rates, revealing health disparities between the formal and the informal settlements in Rio de Janeiro, and high incidence of tuberculosis in areas adjacent to AGSN census tracts, so those just outside of the AGSN. While a retrospective analysis of prevention strategies for mother-to-child HIV transmission in Rio de Janeiro found no statistically significant differences in preventative care compliance. A cross-sectional study of pregnant women with known or suspected exposure to arboviruses responsible for Zika, dengue, and chikungunya found an overrepresentation of residents living in AGSN, suggesting these areas pose an increased risk. So this work seeks to add to the literature on neighborhood construction and the challenges of using opportunistic data sets to contribute to our understanding of the complicated linkages between place and health. With its well-cataloged neighborhood boundaries, rich array of community-level household and demographic data, and growing presence of the community mappers, Rio de Janeiro presents a fertile ground for such an examination. So in April 2010, a devastating landslide took the lives of at least 27 residents in Morro dos Prazeres, a neighborhood of Rio de Janeiro that is officially recognized by the municipal government as a favela. In the aftermath of this tragic event, the mayor of Rio de Janeiro actually attempted to remove folks from these communities using the claim that these areas were considered unstable, environmentally precarious areas. However, residents fought back and actually won the right to remain in their homes. But as a part of that process, residents actually engaged with the process of community mapping, particularly this one group from with the collaboration of the Center for Health Promotion, a collaboration with MIT and public labs, and the United Nations Infant Child Education Fund, sought to actually map some of these communities to do a youth-led digital mapping project, part of this Voices of Youth mapping. And what they did was this map with this application, training youth to take points with the smartphone, noting which areas had assets, so places where socialization can happen, places of play, schools, nurseries, and also threats, areas where their sanitation was a problem, where trash was accumulating, where the landslide risk, walking hazards, and such. On this map, I show you the 10 communities that were actually involved in this mapping work. This happened over 4 years. Over 200 youth throughout these communities were trained and actually engaged in this mapping work. But I'll be talking about the work that was done in Morro dos Prazeres, which you can see the arrow pointing to on your screen. So the methodology for this paper was combining the geospatial data on health threats and resources gathered by the YLDM participants, data from the 2010 Brazilian census, and data from low-income housing registry, as well as semi-structured informal interviews conducted with residents of Morro dos Prazeres to tease out these kind of distinctions of how people engage with the community. And on the screen, you can see the black points represent all the dots that were in the area of Pomona Prazeres that reflected where community members identified areas that were either threats or assets. And what I did was taking this data and using an interpolation, kind of point density interpolation around 30 feet buffer, to assuming that the kind of inaccuracy that's going to come from these devices, and to use that to then overlay on this administrative boundary map to see just how well the neighborhood community conceptions of place match on with the administrative conceptions of place. And as you can see here, there is quite a bit of overlap or bleeding out from the area that's considered the official favela or the AGSN. The AGSN are the dark purple outlines. The favela are the purple slash marks. And you can see that a good amount of these mapping points were done outside of the official AGSN. Some key areas that popped up were the high school, the main road in Santa Teresa, which is the name of the neighborhood that is adjacent to Morro dos Prazeres, and the police pacification headquarters. These are community police forces that were set up in Rio in the lead up to the Olympics. For the interviews, actually came up with some really good data about how people conceive these places. And I'll read you this quote from Carol, one of the youth mappers at the time who I interviewed. And she says, others would say favela. We say morro comunidade, comunidade dos prazeres. People say different things. Before I would say I lived in the favela dos prazeres and not anymore. Now I say I live in the comunidade dos prazeres. So this idea of naming is actually also very important, and I don't have time to go into this for this talk, but I'm happy to talk more in the question and answer period. But another key thing that came out of this was the questions about the quality of the census. So I have these two quotes from Orlando and Anders, and I'll read them here. I don't know about the census data is outside of reality. They think that we are very small. The IBGE says that only about half the people live here. The IPP is closer to the places they consult with. The territory are closer to see the real data. And then Arnander says, I don't believe that there are 2,300 residents in Morro dos Prazeres. I don't believe it at all. I was a census taker. I had to go from house to house to get the data, asking how many people lived here, how many appliances they had. There were two of us working the census takers, and each of us got nearly the same number, 2,300. So there's no way the community could be so small. And I actually wanted to validate this with the census itself, and using the points that were collected from the youth mappers and overlaying and choosing those census tracts to see how these might compare. And so you can see here is if you looked at only the census tracts that are officially designated as AGSN, you get the 3,400 people number and you get the 1,051 households. But if you actually used all the census tracts where the points showed up from the youth mappers, you see almost a doubling of both households and population. So one of the outgrowths that came out of this project, in addition to revealing these discrepancies between the different conceptions of place, but community actually came together and addressing some of their own concerns from their community with very creative ways. And so one was the establishment of the Recyclação project, which is a recycle action, Reciclar Ação. And this project actually provided trash collection in the neighborhood, in the community, and community members actually separated the trash, which they then sent the recyclables down to the formal city for recycling. In the process, they also cleared up areas and made them available for new playgrounds, also made some new community gardens, and really kind of addressed this major concern of community members. Now, you might be wondering about how the connection of health is. So a comment from Elisa actually helps to make that connection. Physically, the food, the air, the area where you live, if the area has lots of trash, rats, the area isn't healthy, you'll be sick because of that. Physical health needs to be dealt with, environmental health, and sanitation, hygiene. Health doesn't just involve the body. So there's a strong understanding of the connection of trash, the environment, and health. And this idea of this Recyclação project, I think, really does a great job to bring all those together very neatly. I'd be remiss to not mention that the 2010 census will be happening in the 2020 census will be happening in August. This, of course, is planned. Given that we are doing this meeting virtually, there are certainly questions about whether or not this will go through as planned, and the questions that I've already raised in terms of the accuracy of the depiction of the communities reflected in the census. So conclusion, wrapping this up here, place designations do not consistently capture the socio-spatial linkage of environmental and health problems. The perceptions of community and extension neighborhood boundaries do not always conform to the administrative boundaries. These different conceptions of community boundaries may contribute to misunderstandings of top-down descriptions of communities and may impact communities and their ability to access resources from the state through a loss of political representation and funding for local services. State-gathered data and place categories must be validated and translated when engaging at the community scale. And this case highlights the potential that undercount for informal settlements globally, and the act of mapping, more so than the map itself, contributed to the fostering of sense of community to address the concerns raised in the mapping process. So I want to thank all the folks in Morros dos Prazeres, folks at UERJ, the State University of Rio de Janeiro, the Center for Health Promotions, Fiocruz, UC Berkeley, many of my colleagues for helping me to make this happen. So thank you very much.